All right. All right. Hello, everyone. Welcome back to another episode of CRNA School Prep Academy podcast. I'm your host, Jenny Fennell, CRNA. And today we have a guest, AJ, who is an ICU nurse. And we're going to talk about how to hit the ground running as a new ICU nurse. So welcome, AJ. I'm so excited to have you here today.
Thank you so much, Jenny, for having me. It's such a pleasure. I've been listening to your podcast for a while now. And now that I'm on the podcast, I'm like so excited and happy to talk about what we're going to chat about today.
Yeah, me too. And it's funny, just some backstory. I actually did stumble upon AJ on Instagram because he shouted me out when he got his shadow experience, because he was a podcast listener and one of the episodes had really helped him really utilize his time in his shadow experience. So thank you so much for that shout out. I really appreciate that. AJ has been an ICU nurse for 2.5 years in a medical surgical ICU, mostly MICU. He recently made a move to California, which we're going to talk a little bit about how he navigated changing roles and changing ICUs as well. But let's kind of start with maybe give people a little more background as far as how did you decide to go into ICU nursing? Did you always know nursing was your field of choice?
I mean, like since I was a kid, I was surrounded by nurses. You know, coming from a Filipino family, there are many Filipino nurses. I want to say more than half of my family is in healthcare. Maybe half of that are nurses or nurse practitioners themselves. Like PTs, OTs in my family, doctors in my family. So I was kind of primed from the beginning, and I knew that nursing was more of a financially stable career, very flexible with hours, 3 days a week, 3 shifts a week. And with that in the back of my mind, science was something that I really liked too. And being able to put that together into nursing was something I wanted in my future as a career. It wasn't like, a certain moment that happened in my life where I decided, yes, this is the moment I want to go into nursing. It was more something that I had to suss out for myself in high school.
Love that. I love how you started it early in high school, though, and you always knew that the science was a big draw. I think a lot of us can relate to that. I know that's sure how my interest started, where I was watching Discovery Health obsessively when I was little, like surgery shows. I used to think I want to be a surgeon. Either way, I just knew I loved science, right? So that's really cool. I love that. And the fact that you have a family, that's really interesting, though, that, you obviously have a lot of nurses and medical professionals in your family, but you did choose nursing. And not only that, but you chose ICU nursing. So I think that's really unique. And let's kind of get into when you made the choice to go to the ICU as a new grad, how did you go about navigating that? What are some things that you think really helped you get that ICU position?
Yeah. So with my background, it's a little different than what most people go through, because all the way back in college, when I was an undergrad, I went to a 4-year BSN program. I had the opportunity to apply for a scholarship that would kind of pay for almost half to a third of what my tuition was for my junior and senior year. And as a result, I was kind of bound contract wise to work at a hospital. So I was able to already be able to work in a hospital. It was more so what specialty, how would I approach these units? And I was able to have my clinical rotation at the hospital that I was going to end up working at. And I ended up applying for ICU for my clinical, like my senior clinicals. And from there, really, the clinical was my interview. It really spoke for myself, like the skills. That's something I tell all the nursing students who I chat with on Instagram. That was the advice that I got from nursing students in my program, was that clinical is an interview. And that's how you should approach it, because you never know when you're going to whenever you're going to like meet someone from that unit. You might end up interviewing for that unit again, and you want people to remember you for how you presented yourself,
Love that.
How did I end up in the ICU? I feel like that's something that's always been in the back of my mind since I started nursing school. And I really like the autonomy, and being able to have the provider on the unit was a really big draw to the ICU, and being able to experience that as a student kind of solidified it for me, that critical care was where I wanted to end up.
Awesome. Big takeaway for me from what you just shared was the fact that you guys, he did this. First, AJ requested to get his rotation as a senior nursing student in the ICU. That is really, really key and really vital when it comes to, again, the exposure to even know if it's something you really want to do. And like he mentioned, the job interview aspect of it. It's kind of a long-term job interview, which I actually even tell current nurse anesthesia residents as well, because every day, the way you show up, your attitude, and essentially how much effort you put into your learning really goes a long way and shows your future coworkers, hey, I want to work with AJ. He seems like a really good team player. His attitude's always upbeat and bubbly. I really enjoy having him around. 100% the best way to essentially have people really vouch for you when it comes to getting that job after school. So if you're a senior in nursing school, try to get into the ICU as your senior clinical rotation. I also love the fact that he stressed that that is what solidified his desire to even pursue ICU. You guys, the ICU is really its own realm. And I know I've shared here on the podcast before that I was not crazy about the ICU, but it had nothing to do with the actual ICU concepts. It had more to do with the death and suffering that I tended to have a much harder time with. But I really love the environment. I love the fast pace, the critical thinking, the really complex disease process, pharmacology. That was right up my alley. And I was just like, ooh, I thrived. I felt on fire and alive when I was constantly thinking about those things. So I knew, yes, the ICU would be hard because emotionally I have a hard time. Like I am the kind of person who I wear my heart on my sleeve. And I mean, I will crawl in the fire to get you out kind of person. And so when I saw my patients suffering, it really hurt me to not be able to do more. But that's something, you have to work on. And, so either way, I encourage you to get this experience because it's going to allow you to see whether you're really going to enjoy the day in, day out of being in the ICU. So that's how you landed the position. You mentioned residency program. You applied to a residency. How long was that residency program?
Yeah, so my residency was also different than a traditional residency because essentially I was a part of two different residency programs, one for my hospital itself and one for the hospital system. Um, so I guess like talking about the residency in my hospital, it was like a 3-month stint. I was already hired onto the ICU, but part of that 3-month residency in my hospital had to deal with rotating through different units to get a grasp of, what it's like on the telemetry unit, for example, which is where we would float if we were needed from the ICU to telemetry. I was able to stay on the ICU for 2 out of the 3 months that we had the rotations. And also integrated into that were shadowing opportunities in different practices throughout the hospital to kind of hone a good global interdisciplinary understanding of how the hospital works as a system. So that means like phlebotomy, lab, pharmacy, the residents we would shadow, and kind of talk about it afterwards in a debrief every Thursday, which we called Thirst for Knowledge Thursdays, is what the program director called it.
Oh, I like it.
Yeah. And then, so that was for 3 months, right? And then there was the 12-month hospital system residency. So that was like seminars every other week where we would go to Philadelphia, which is where all the hospital, every new grad was in a residency, and all the hospitals in the system went to Philadelphia for these seminars, sim labs, debriefs, and then of course an evidence-based project at the end of the year that we would work on for around half the year.
Wow.
So I would say my new grad experience was very well integrated, and I was able to get a good global understanding of one, how the hospital works, and networking between hospitals as well.
I like that. So you guys, I know AJ has explained that his situation was a little unique, but I guess maybe let's back up just a smidge. How did you find the opportunity, the scholarship opportunity that kind of got your foot in the door that way? Was that something that you actively sought out? Did you know about it from a friend, family?
It was actually back in nursing school it was the nursing school that partnered with the hospital. And it was offered internally to undergrads.
And you had to apply for
So
that.
I applied, I think I interviewed for it,
Mm.
and then I was able to get the decision, I think sophomore year.
Nice. Okay. Well, that's really unique. And that's something that if you guys are thinking about those things, you should start seeking out opportunities like that early on in nursing school, because that's a really cool opportunity.
Mhm.
It's funny sharing my own experience. I was telling AJ, mine was back 2009. So I feel really old, but things, while they're similar, they have changed. Back when I graduated, nurse residency programs were relatively new. It was relatively a new thing. I remember it being kind of a big deal that my hospital all of a sudden now had a residency program, because prior to 2009, they were direct hiring nurses aides out of the ICU and just all on the job training, right? It wasn't anything else to it, which worked really well. But I think they started making a lot of changes. They also started saying they only took BSN prepared nurses in the ICU. So there's definitely a lot of things to start considering when it comes to that. But a residency is always a great way to get into the ICU as a new grad. I will say, as AJ mentioned, one of them was 3 months. That was my experience. It was only 3 months, and we did rotate. I went to the surgical ICU, medical ICU, and a step down unit was my rotation. And clearly, since I'd worked as a nurse's aide in the medical ICU, those nurses were like, "You're not going to leave us, are you? You're going to come work here, aren't you?" And I'm like, "Yes, of course, I'm not going to leave you." So essentially, I knew I had a job in the medical ICU. They loved me. They wanted to keep me. It was to me, it was a no brainer that yes, I'd go back to a unit. Then I knew I'd be supported emotionally and physically by the nurses who were essentially, I call them like they're my work moms, right? They were looking after me, and work dads. There was dads there too, but they knew me so well that I felt so supported. And that's why I went to that environment. Even though, to be quite honest with you, I was way more intrigued with the surgical ICU population. I went to the medical ICU because that was where my work family was. But yeah, so different experiences. And the 12-month residency program that he went into afterwards, it sounds like was a lot of education, with seminars and reflection, simulation, shadowing, which holy moly, that's amazing. I think that's incredible, actually, and really, really good experience. A great way to get into the operating room to see, the transfer of care from OR to ICU. Evidence-based project. I will say, though, that my 3-month residency program, we did do a residency-based project, even though in that 3-month stint was relatively short. And I think we worked on it longer than 3 months, but essentially after 3 months, we then started our unit hire orientation, which was probably, I don't know, another month or 2 at the most, where you just were paired up with someone. But yeah, so another great thing about residency programs is the evidence-based project that you will more than likely have to work on, because that's great for applications. Hint, hint, wink, wink. So I love all this information. So great. So you mentioned interview, and I know you mentioned interview for the scholarship, but let's talk about ICU interview. What did you have to interview for the ICU you eventually got hired in on, and what was that like?
Yeah, I did. I still did have to interview for the ICU. From what I remember, it was like the assistant nurse managers who showed up, and my nurse manager. So maybe around like 5 or 6 people were there. It was me at the head of the me at the head of the table, and of course, I was nervous. I was a new grad nurse, and all I remember was maybe a lot of situational questions, personality based questions. Um, I really was able to do well in the interview because I already had ICU experience because of my clinicals, and already having a foundational relationship with the staff gets a good word out there. So that's like a really good tip to going back to what I said earlier about, getting your foot in the door in an ICU, even if that's not the ICU that you're going to work or that you plan on applying to, having that background, especially when they ask questions like, tell me about a time when you went above and beyond for a patient, and situational questions like that. When you manage conflict, pulling that from clinical experience is how I really was able to, stand out
Mhm.
in that way.
Oh, I love that. And I also can tell just from our conversation that we have right now that you're very calm demeanor, which I think is really great. Cause I'm sure, I mean, you come on the podcast, which that's sometimes a very nerve wracking thing. Like, oh my gosh, I'm on a podcast, but I can tell that you have a very good way of kind of keeping your composure. But I love the fact that you also reiterated the fact that you establish relationships. So it becomes more of a casual, conversation versus this high intense pressure environment. So I think that's really key. I also love how you pointed out they ask situational type questions as well as personality. But the ICU experience prior in your residency program really helped you have a good understanding of what the ICU nurse's role is. So they were able to, they understood that you knew exactly what you were getting yourself into. So they probably didn't have to drill you as hard as someone they wouldn't know had that experience, right? Like for me, my interview was so incredibly, it makes me kind of chuckle because it really wasn't an interview. It was like, okay, cool, Jenny, you're coming to work for us. Bye. Like, it wasn't even like, I don't remember even getting asked hardly anything. Like, it was maybe why, what are your long-term career goals? And maybe some situational type questions. But for the most part, it was like, okay, cool, we're excited to have you. Here's paperwork, sign here kind of thing. But that being said, I also want to stress to you guys, especially those of, well, obviously you're listening to the podcast, so you are future CRNAs, but you may not have a real grueling interview process in your ICU time if this is your situation. And so you may, and I see a lot of my students struggle with this because going into the CRNA interview is really the first experience they might actually have with a truly grueling experience with people they really don't know at all. And it can really, it really can kind of rattle them a little bit because again, they've never experienced a kind of high pressure environment, and they will ask a lot of questions and they're difficult questions. So I want to make sure those are listening kind of put those two things together if you ease your way to the ICU with a residency program.
Yeah,
But
Jen,
the next,
can I mention something real quick?
yeah, of course.
When you talk about the like the grueling part of CRNA interviews, you mentioned in your podcast before, like you always prepare for your CRNA interviews, even before you submit your application, right? You always reiterate that. And so even when I was interviewing for the job that I'm going to take now, that was one of the more grueling interviews, like pharmacologically, pathophysiologically, right? And already being prepared or preparing from an ICU background for that, like they were asking about sepsis, they're asking about, ventilator settings. And I was like, oh my God, this is probably one of the most difficult interviews that I've had, compared to being a new grad. And having that in mind just rings that bell. Like you always have to stay on your toes and be prepared for situations like that.
Yes, I love that. And I also, the fact that they didn't know you, right? So I do think outsiders coming to the ICU, they're going to probably drill them a little bit harder than someone coming straight out of residency program. But I love the fact that you listened to me. Thank you. I always wonder how much of my talkings and my teachings get through. Because I see that all the time where people are like, but I thought I wasn't going to get an interview. I'm like, but you applied. If you applied, that means you're going to get an interview. So you should treat it as such versus it's almost kind of like you're kicking yourself before you even get a chance. It's like just you've taken the opportunity to apply. That means you're taking the chance you're going to get an interview, which means give yourself the best chance possible and prepare. So I love that you're doing that. And see, it helped you. It helped you the fact that you're already preparing for the ICU knowledge you need to know going into interviews in the future. And it helps you land this next ICU position, which I would love to kind of maybe touch on. I know we didn't have it on our schedule to talk about, but you mentioned where you moved, and we're not going to mention hospital names or anything like that, but the area, the environment's more competitive to gain a good contract. So what do you think so far? I know it's relatively new and fresh, but what do you think you've done that has helped ultimately land your next ICU position?
I mean, I'm not going to go into the nitty gritty details about like applying for contracts. That could be like its own episode on its own. But I want to say once I was able to get an interview for a hospital, for a unit, I was already primed with the knowledge that I had in the past. And I was actually doing some studying in the background, knowing that because this is such a highly competitive area, that I have to know everything from a granular level. um, molecular level almost of ICU level care. And being able to prepare for that really helped me shine because first of all, they cold called me and I was at the gym, right? And I was like, I need to answer this phone call because I don't know when the next person is going to call me. And that's where I left the gym. I took the interview. It was like 45 minutes.
Wow.
And they were like, okay, so when can you start?
Wow. Well, that's
Yeah,
impressive. Cold call. Yeah. No preparation, just
no
ready. Let's go.
preparation.
Well, that's good to know. Interesting. So I love that. So that kind of, you guys, goes back to just really honing in on your ICU knowledge, because that's what these units want to see. And the little bit of ICU tips I can give you from the students I've talked to is just that. They really do want to understand, if you understand ventilators, different types of disease processes, meaning if you're applying to a CVICU, you should really have a good understanding of those types of patients and the disease processes around what you would be doing. Medical ICU, same thing, sepsis, I don't know what else they would add, respiratory failure, that kind of thing,
Mhm.
ARDS, understand those disease processes. So did you feel like the residency program, it sounds like it was pretty extensive, but did you really feel like it really truly prepared you in the ICU, or was there anything that maybe caught you off guard when you actually started on your own ICU?
I'll say that the residency itself was more so to help me transition as baseline as a nurse, to be familiar, to be able to be familiar with how to be a nurse, like bedside skills and stuff like that.
Mhm.
Um, kind of be able to talk to other people who are going through the same thing, which I think is probably one of the best advantages of going through a residency because it was just me who was orienting on the ICU. So being able to have other new grads in my cohort to talk to about, the imposter syndrome that we all go through, the struggles of multitasking or how to prioritize,
Mm.
that was how the residency helped me.
Mm.
I would say it was really my coworkers who like finished the process of that orientation and being familiar in the ICU that got me to be comfortable in that environment. Less so the residency, more of my coworkers and the relationships that I had on the
Yeah.
ICU.
No, I like that because that's your support system.
Hmm.
And very similar. I know I'm always doing these comparisons, but I think the same thing applies to CRNA school. Your classmates are your biggest support system by far. And I don't get me wrong, I'm sure your spouse loves you, your kids love you, but it's something about someone else going through the very unique, similar process and experience that you can relate to that really can keep you up when you're down, because you're both going to have roller coaster rides. You're both going to feel stressed for different reasons. And sometimes it's really hard for someone from on the outside who doesn't understand, who's not in it, to really truly feel that empathy, and that it's hard to relate to, right? They just kind of stare at you like, you okay? So I just want to stress that while we're have it on topic. But what would you say would be the biggest challenge? You mentioned time management and prioritization, but would you say that that is your biggest challenge as a new ICU nurse?
Being a new grad ICU nurse is like two extreme challenges at once because not only are you getting used to bedside skills, bedside manners, time management, like I talked about earlier, but it's also like trying to master the ICU knowledge that's on top of that. So when you layer both of them together, it's like, oh my God, this is so overwhelming. And that's exactly how I felt. I'm sure everyone's been in those shoes before. Like, I can't do this. My preceptor is so cool and awesome. And how can I end up being like that? Um, so those two challenges, like tackling them together at the same time was my biggest challenge. And I feel like the way that I was able to get over that was to, I don't know, really see my preceptor, my preceptors as people to trust. I had really good relationships with them, um, to kind of talk through the process of what I was thinking so that I could get their input. Because at the end of the day, the preceptor is there not only to teach but to um, like bounce ideas off of too, which by the end of my orientation, that's kind of how I I treated my relationship with my preceptors became, because that's where my critical thinking really, I was able to get a good grasp on it by the end of that orientation by having that relationship with my preceptors.
Yeah, I love that. I love the fact that you had that open communication piece, that being able to ask questions, That is so, so vital. One of the things I think a lot of students who enter CRNA school really struggle with is, and one thing that I think does make it extremely hard, is you're with different people all the time. Meaning you're not building that trust, that relationship, because you're bouncing around from CRNA to CRNA to CRNA. And you haven't built that trust yet. It takes time, right? So sometimes students can feel intimidated or scared, or feel like they're going to think that they're stupid or they're not good enough or whatever it is. So they don't ask. And then something that shouldn't happen happens, or they don't do something they should have done. And it's kind of one of those things where it's like, oh, if you just would have asked, so I preach this all the time. And it's the same thing goes for the ICU, adjusting as the ICU. Ask questions to the residents, to the fellows, to the attendees, to your coworkers, to anyone who will listen. Ask questions. Yes, of course. I'm not saying don't look it up yourself and take initiative. Of course, you want to take initiative. But if you are in the moment and you have to know something, or if it's really going to make or alter your decision you're going to make, ask. If it's something that you can look up later because it's not pertinent to what you're currently doing, cool, look it up. But if you need to know it in the moment, then 100% you guys need to be asking questions. And like AJ said, find that buddy system, find someone you feel comfortable with who is going to treat you like an equal human being and not talk down to you. You will be able to find them. Sometimes, don't get me, I don't agree with it, but sometimes you will have people who are not those people. You will quickly be able to know who those people are, and you just avoid them and you ask the right people. Phone a friend if you have to, right? So that's really great advice. I love that. So what do you think, what knowledge do you currently, or skill set do you possess now that you feel like you didn't have when you first started?
I mean, I could name anything, right? And then that would be a good skill.
Everything.
But everything. I'll say, like, generally speaking, critical thinking and time management have been a godsend. Being able to kind of have that kind of integrate into my practice really adds to the confidence that I have in the care that I provide. Also having that ICU knowledge and kind of like knowing the surgeries or the disease processes helps me talk with families, and kind of putting that all together. I will say, generally speaking, is the skill that I possess now. When I think of a more specific skills, I really got good at ultrasound guided IVs.
Nice.
And that was an initiative that they started on my unit, maybe like halfway through, or like a year after I started. And yeah, being able to put in those IVs and be like the go-to IV guy has been really cool. Also knowing devices like CRT, TTM, being assigned those really sick patients was a really big confidence booster too. And having those patients, honing my ICU skills, being familiar with the machinery, devices like that, on a more specific level, I'll say those are the skills that I was able to get.
Yeah, I love that. So big picture, obviously the confidence, being able to manage your time and prioritize and critically think enough so that you could actually educate the family and feel confident to do so. I love that. Because but you've always gone back to knowing your critical care knowledge. I love that because it served you in so many ways. So I really think that that's key to not rely on, because I think it's so easy for us as human beings to, and I am guilty of it too. That's why I'm mentioning it. I'm equally guilty. And in the anesthesia realm, is sometimes you get very comfortable in what you do, right? So you walk into work, you do your thing, you go home. And sometimes you don't actually think about what it is you're doing. You become kind of like this machine or this robot. You just do, and you don't always put the thought process behind it. You just know it works, right? So what I actually love about teaching and what I love about working with students in the operating room is it helps me to slow down and explain my thought process, because otherwise I may just not think about it, right? So I love that aspect of teaching, and it really keeps me able to be cognizant of my own growth. And so I don't get complacent. And I think the same thing can be true for the ICU, to always be aware of, are you thinking about the cause and effect relationship, the disease process, how this drug works, why they pick this over that. And if you can really always have that inquisitive mind, you will flourish in a way that is so rewarding, and it causes so much career satisfaction. So I love that you pointed that out. And then as far as skills go, yeah, of course, you're going to take sicker patients now, learning advanced life support mechanisms and IV guided ultrasounds. You're going to be a whiz when you get to your regional rotation. It's funny because I have a lot of students who tell me about the IV guided ultrasound and how that's a skill. And I think that's really great. But I also want to challenge you guys with not, because I mean, while I think that's amazing, I often hear students say that that's really great, but we don't, I'm just being honest, in the operating room, we don't have ultrasounds for all the operating rooms. So typically if you're doing A-lines, IVs, you're not going to the ultrasound first thing. So definitely make a point to, especially in your anesthesia training, to seek out regular IVs. I've had students who go spend a whole day in pre-op, which is a great way to get IV experience, you know? And I just love starting a 14 gauge. It's probably my favorite thing. And I also now love the challenge of starting a 24 gauge on a plump little baby, because, oh my gosh, holy moly, you have no idea. You just go by landmarks at that point. But what's really cool about a plump little baby versus an adult, a plump little baby, those IVs can take all kinds of pokes. I mean, you can poke and poke and poke and they're fine. And then you can still get a good IV despite being poked 100 times because they're so buoyant and bouncy. They dart the needle. Where an adult, less forgiving, right? If you puncture that, it's like blown, okay, new spot. So definitely some differences between babies and adults starting IVs. The technique's actually different. But getting that experience, whether that's in the ICU, one of the things I used to do was I think it was around 2 a.m. I can't remember. Whatever we would do, I worked in the MICU like you did, and we would have line holidays, central line holidays. So good IV access was really crucial. And so every 3 days, 72 hours, 48 hours, you'd have to restart a peripheral IV. And so I would actually do my assessments early, have a buddy watch my patient next door, and I would walk around the unit and offer start IVs for everyone. And, you know, some of these patients would have 3+ pitting edema. And you're like, holy moly, I got to find a vein in that arm that's the size of an elephant trunk, you know? So that was challenging, but seeking out these opportunities is only going to help you in the long run. But I think all those are really great takeaways. What do you say you enjoy the most about ICU nursing?
Oh, let me think. I will say what I like the most, generally speaking, is the autonomy and the collaboration. You know, when you're in the ICU, you have essentially, from my experience, I had the providers right there. I worked with NPs and MDs and DOs, and they're right there on the unit. They're either a call away or you just walk down the hallway and they're right there if you need anything. And when it comes to the autonomy part, taking care of the really sick patients on multiple drips, whether that be like nurse-driven heparin or insulin protocols, or even like the vasoactive medications, like you as a nurse have the autonomy to make the clinical judgment and titrate these medications. Autonomy can be on the side of patient care too, and just being able to use. I'm always going back to the ICU knowledge, but like, and when I talk about my background, I really liked science in high school, and being able to kind of put that all together in the ICU, and answer the question why every time, is what really draws me and keeps me excited in the ICU. Because I feel like that's being a preceptor has been really helpful, because like you were saying, it helps you understand the really fine details of why we do these things. And as a student, as a new grad, asking why has gotten me through a lot, and I've learned a lot by asking why.
Love that. And it goes back to like, that's how toddlers learn. For like 2 straight years of a toddler's life, every question's why is the sky blue? Why? I'm like, I don't even know. I don't know. But yeah, as an adult, same thing. I think we kind of forget that, but asking why is a really integral way of how we learn. And then what's interesting about asking why too, is even if you can look it up yourself in a book, cool. I encourage you to do so. But when you ask someone else their why, you will gain a perspective that you won't have. Everyone understands knowledge differently. Everyone has a way of understanding knowledge differently, and they can share that with you, which is really powerful. It allows you to essentially add to your own knowledge in a way that maybe you never would have grasped before. One thing I want to kind of slow down and back up, because I want our listeners to really think about this, especially because you're applying to CRNA school and they ask you, why do you want to be a CRNA? And people just say autonomy, but then they stop. You said autonomy. and there's nothing wrong with autonomy. I think it's great, but you backed up with why. So you gave really good reasons, but you also mentioned collaboration. And I think that's really important because you guys, being a CRNA, yes, you have a lot of autonomy, but you collaborate. It is a team effort. So if that's not something in your wheelhouse, you will struggle, and it's frankly not even safe. It just in general, as a patient care model, it's all about collaboration. Yes, you make decisions, which is the autonomy piece of it. And like you said, you currently have protocols you follow, and allows you the knowledge space to say, I know how to safely titrate this drip. Yes, I'm following a protocol, but I'm also learning and understanding how this medication works and how to fine tune it based on this patient's disease process. And that goes back to your ICU knowledge and understanding what's going on with the patient. Understanding their disease process allows you to understand how these drugs will really affect them. So I love that part. It's okay to say autonomy. It's okay to say it. You just have to make sure you're backing up with, well, how is that? How do you see yourself in that role as a CRNA provider when you speak of wanting autonomy? What does that mean to you? And so this was a beautiful answer to that, especially even as an ICU nurse. And so this is why I did a whole podcast episode about, CRNA being different than ICU nursing, but there are so many similarities, and this is definitely one of them. So re-listen to this and put it in your notebook. What would you say you dislike about ICU nursing?
Well, with ICU nursing, of course there's a lot of charting, right? You have these I don't know, you can go from Q1 to Q1 like every minute, or like every 3 minutes, 15, 1 hour, and you're continuously charting, which I think is a good and a bad thing. It's push and pull. The main thing that I dislike about the ICU, especially getting off of orientation in March of 2020, what is death, facing that every day, and trying to, keep in tune with my own humanity, and patient dignity throughout it all, has been like one of the most difficult parts of being an ICU nurse.
Mhm.
As much as I dislike seeing all the death, I've really come into myself about, reflecting about who I am, bringing back the humanity of the patients and the family members. And it's been such an eye-opening experience, especially getting through all these peaks of the waves of the pandemic, through it all, especially when nurses are like, I've never seen nursing like this before, or I've never bagged and tagged so many bodies before. And that's the only experience that I know,
Yeah.
So being able to take care of myself, healthy coping mechanisms, of course, have really taken me a long way, coping with the things that I dislike in the ICU. Definitely.
Wow. AJ, you just give me goosebumps. I just love everything you said. And first, just thank you for everything you've done over this last 2 years now, 2.5 years going on. I cannot even imagine. I'll share you guys a little background. I know I mentioned 2009. You probably don't remember this because it's really insignificant compared to everything else that has gone over the last 2.5 years. But back when I first started in the ICU, it was the H1N1. That was like a very scary thing that occurred. Girls, a lot of pregnant girls and girls my age in their 20s were dying from it. And it was kind of scary to walk into an ICU room with someone who's literally have the same birth date as you and they're dying, and all because they have a contagious virus that you're just like, this is scary. I don't want to get it. And we saw a lot of people lose their babies and a lot of people delivered in the ICU. It was a very intense time, I thought. And I can't imagine like that on fire times a million is what this pandemic has done. And I want to hone in on the fact that, and I had to deal with this too. And I mentioned in the beginning how I had a hard time coping with all the death and suffering. But what it did is, and I saw this happen time and time again, is sometimes these nurses who were in it for a really, really long period of time would kind of put up their armor and lose what I would call empathy or compassion. And like you said, kind of bringing it back to it's a human experience and thinking about the families and the patient and what they're going through. It's hard to do that without also suffering yourself, because you, as a human being, you naturally want to love and care and help someone. And so it's so emotionally draining and just it tests you. It tests you. It's like being in a war zone, right? It's not good for your soul. And so I don't know how nurses do it for their entire lifespan. Some people I think are just, angels in disguise. I truly believe that. But I also had seen it have the effect of, becoming someone who just separates it, and so much so that it really affected their ability to have kind of a soft shell, a soft heart, which is upsetting, right? And I remember thinking, I don't want that to happen to me. I like my softness. I want to remain soft, right? So I think that stems from, like what you said, the coping mechanisms that you have in self-care, and then understanding who you are. Like, one of the things that it took me a very long time, but I thought a lot about death. I thought about how I feel about death. What if I die tomorrow? What if my mom dies, my sister dies? So many times I have a patient who would remind me of my family, and I would feel like I was walking in my room with my dying father in front of me. And or you would really relate and make a relationship with a family member, and then you have to watch them sob, and you're just like, oh, like it was so emotionally draining. And that by far for me too was the hardest part about being in the ICU. But when I started really coming to terms with how I felt about death, and not thinking about it in such a negative way, and realizing that that is just a cycle of life, that's a part of, we live. And and the thing that these patients, they want it all done, they want to be there, they want to fight, right? And so we're there to help them fight. And even though sometimes it feels like you're doing the opposite, like you're torturing them, they had a choice. Their choice is to be there and fight. They know when to give up. That's a human, your bodies will know when to give up. And obviously as an ICU nurse, you watch it unfold before your eyes. But you guys seek out help, whether that's a lot of hospitals, I think now, especially now, have, therapy that's free for ICU nurses, but don't be afraid to get help, to have someone, a resource to talk to. And sometimes, like I mentioned earlier, it shouldn't be your significant other, because they're not going to understand how to help. They want to, but I need a professional is kind of how someone who can really understand how to help you cope, how to help you have a mindset around what you're experiencing. And also being recognizing that it's okay to be mad, to be angry, to be fearful, to be scared, to feel like you're grieving, because you're grieving someone else's life. And that is a human experience that you need to hold on to, because that is part of who you are as a human being. And being okay with that, and not making you feel shameful or disappointed, or that you're weak, or that you're this. No, you are strong. The fact that you were in there doing it day in, day out, dang it, you are strong. You're there, you're showing up, and give yourself a lot of credit for that. All right, that's enough of my soapbox. I got really passionate about that one. But thank you for sharing that, AJ. I thought that was really, really great. Do you think you missed out on anything by skipping med surg? It's totally changed topic here.
on a lighter note,
Yeah, on a lighter note. Yeah. You did mention how you transferred to tele during your rotation, but do you think you missed out on anything by not getting the true med surg experience?
I think I did. A lot of people I follow on social media, on Instagram, they really talk about med surg as like med surg is its own specialty, right? ICU is its own specialty. People get certified as a med surg nurse, right? And there are people who love med surg. And I feel what I missed out on was just the sheer multitasking and extreme organization that is needed in that setting. Sometimes in hospitals, like, okay, I was floated to tele one time or a few times in my previous hospital, and I've had to take care of like 6 patients at one point, which one is maybe not the safest, but secondly, like daily people would take care of 5 to 6 patients at nights on that unit. That's something that I'm not used to, because I'm used to my 1 to 2, 1 to 1, 1 to 3 sometimes. And that's something that I could never get used to unless I worked on a med-surg tele unit. And it's the efficiency that the nurses have over there that we as ICU nurses probably can't switch on or off if we were to float there for our lives, So that's where I really have a lot of admiration for nurses, like med-surg nurses, med-surg tele nurses, because they know how to run around, get to their patients, get their assessments, chart on time. times 6.
Mm-hmm.
We have
Yeah.
to worry about our 1 to 2,
Right.
which is probably one of the cush parts about being in the ICU.
Mm-hmm. I love that. But you're right. It's a different specialty and it's a completely different mindset, different strategy that goes behind, like you said, the efficiency, the organization aspect of it, the multitasking. But I guarantee if you were to put a med surg nurse in the ICU, they would also feel like a fish out of water for the complexity and how kind of probably scary I would think it would seem to have a patient who is now on death's door and they have to somehow know when they need to speak up and say something when something's going wrong. But it's just different. And so I guess I want to hone in on if you have med surg, bring it because and own that strength and be proud of that. Don't be shameful. Bring your med surg experience to the ICU, but don't think you need to start there because it is its own specialty. And as long as you're sure, I do think, like AJ said, if he were to get his foundation in the ICU and then choose med surg nursing after the fact, don't get me wrong. I know you can do it. Anyone can do it. You can do it. If you can go both ways, you can go both ways, but it's going to be a big adjustment. And maybe not something you even like. So I encourage you, and that's another aspect I get to is some med surg nurses who want to become a CRNA. We're like, I don't know if I'm going to even like the ICU. You're right. You won't know that, but you're not going to know until you try. So shadow if you can, and find a residency program. I don't know how many residency programs take experienced nurses, but they have to be out there. So seek those opportunities out. And so that way, if you get halfway through and decide, oh, this isn't for me, well, then it's not for you. But the only way to CRNA is ICU. So cath lab, PACU, operating room. What else do I hear? Pre-op. It doesn't work. It doesn't work, unfortunately. Don't get me wrong. You say, well, I know someone, Jenny. Yes, I'm sure you might know somebody, but that's not the more common. That is the outlier. And chances are they have prior something that gave them the cutting edge they needed to apply. So you might not know that part. Most of the time, it's usually a previous skill set ICU experience that allowed them to get in with cath lab experience. Anyhow, I think that's great. I love how you separated that. What advice would you give to those considering going straight into the ICU as a new grad? Kind of sound off.
Yeah. I guess I would say you got to do your homework. You got to put in the work because, if you're a new grad in the ICU, you're already overwhelmed with all the new things that are coming at you on top of being a new nurse. You don't know how to nurse, and that's something that you're learning at the same time. So doing your homework outside of work, or in your downtime, looking up why we're doing this, the types of the diagnoses that you're working with, maybe even getting like a CCRN book or resource to kind of feed off of, because I found that the CCRN books, they condense it really well and they kind of get the essentials out of it. So say you're working with sepsis and a patient in septic shock, you just flip to the chapter about septic shock and you're like, oh, okay, that's why we're giving this, that's why we're doing that.
Mm-hmm.
That's my biggest advice. I mean, on top of being inquisitive, be a sponge when you're with your preceptor. Maybe not everything that your preceptor does is kosher or along with the textbook. I mean, real life nursing is nothing like nursing school, let's be honest. But being a sponge and learning from the people who are teaching you, writing down notes, maybe even journaling sometimes. That journaling was something that I did maybe for 6 months, I want to say, as a new grad. And funny enough, maybe like a year ago, I looked back at my first entries and I was like, I've really grown as a nurse. Being able to see that progress because you're working every week and progress is seen in tiny increments, but when you reflect back, you see the huge jump that you've made. So that really helped with my confidence moving forward.
I love that.
And I guess like a last point is like, where is it? You have to know that the people that you're working with have been in your shoes. Everyone that's on your unit has been in your shoes, has been uncomfortable. And coming to terms with that, from my experience, has been helpful overcoming these imposter feelings, imposter syndrome, because you're going to end up in that higher position. You're going to become a senior nurse on your unit. eventually with new hires and whatnot, and you're going to be the resource for people in the hospital, maybe even become a preceptor or a charge nurse. So being humble is like it's the lesson that I got out of that.
I love that. Those are such great takeaways. And I love the fact that, yeah, it's relatable because everyone has to start somewhere. You're always a learner. And as long as you're humble and essentially help others see that, yes, you may think that you can never do this, but the reality is you will over time. And the fact that you journal and can see your progress, I think that's a really great way to just feel gratitude towards how far you've come. And I know I've spoken about gratitude before in the podcast, but that's one of the most powerful human emotions you can actually ever experience other than love. But that is so powerful because it really just keeps you going. It keeps you fueled up and satisfied in your career. So I love the fact that you brought it back to that. Well, AJ, this has been so amazing. Oh my gosh. This is by far one of my favorite episodes I have ever done. So thank you so much for being a part of that. And where can people find you and connect with you on social media?
Yeah. You can find me at AJ the Nurse, both on Instagram and TikTok. I just journal my life and talk about anything that comes up. I initially it used to be more of like an ICU nurse informational type of Instagram, but I've transformed it more to like a personal, every now and then we'll get into nursing and whatnot.
Nice.
Just my
All right.
journey. Yeah.
Well, great. Well, thank you so much. And I'm about to find you on TikTok because I'm on TikTok now, trying to learn it. I'm trying to be humble about it.
Thank
All
you
right.
so
Well,
much, Jenny, for having
thank you
me.
so very much.